Good afternoon. My name is Rachel Leventhal-Weiner. I'm the Chief Research and Planning Officer here at the Office of Early Childhood. This afternoon, Commissioner Bye is going to offer an update on questions that we have received, frequently asked questions from the field. Everyone is in listen-only mode. If you'd like to submit a question during this broadcast, you can do so using the questions pane, and we'll get that question to Commissioner Bye after she finishes her address. This broadcast is also being recorded, and we will share it out with the field after the call is completed. So with that, Commissioner Bye.
Good afternoon, everybody. Thank you so much for joining us today and for your questions and input ahead of time. I'm hoping that we hear a lot from you as we're all making our way through this completely unknown pandemic, this process of making our way through a pandemic. We're doing it together, and your questions and criticisms and guidance are helping us, and we look forward to continued conversations with you and feedback and questions and answer. On behalf of Governor Lamont, I want to be really clear about his position, which is that Connecticut needs to focus on assuring that we have childcare for essential workers today, but also a supply of childcare during the recovery and after, because childcare is critical for Connecticut's workforce and infrastructure. Certainly, the events of the past few weeks have pointed out to the whole state how important childcare is for public health, for child safety, for learning. And you all have had difficult decisions to make and huge challenges, and we're with you in that. This is a fluid situation that we're dealing with. A pandemic is by definition unpredictable and changing. So what we can promise to do is to keep you informed. If OEC policies or approaches change, as they did, I just want to reemphasize, we understand how difficult this is. We hear you, we're thinking about you. The OEC staff is working hard to reach out to you to take your feedback. Each of you plays an essential role in Connecticut's childcare infrastructure, and indeed in Connecticut's overall economic success. We are a complex system: public, private, family childcare, nonprofit, town-run, Board of Ed run. And we understand that you all are looking to us for information and leadership. We are working hard on communications to issue memos in an orderly way and send those out to you. We're working to be clear and consistent with our messaging, trying to work hard to keep misinformation to a minimum and responding to misinformation. I've talked to many of you on the phone and heard your stories. Some of you, you've put your life into building childcare programs, and now you're really concerned about how they're going to go forward. So I just want to be really clear that we hear you. The OEC is part of what's called the Emergency Service Function 14, which is about economic recovery. Obviously, we're all about children and families, but we rely on businesses to support children and families. So we are trying to stay plugged in. We have a call today with Commissioner Lehman to discuss specifically some of the childcare needs. Coming soon in terms of communication is we're going to have a dedicated space on the Office of Early Childhood webpage with information for you about business supports that might be available through the state of Connecticut and through the new federal bill. We also are keeping early childhood education information there as well. Memo number 12 is focused on business, and we're updating that. But that's going to shift into having a web page that's flexible as new programs start up. At the core of all this is the health and safety of children and families, and the health and safety of the early childhood workforce. And so I wanted to walk you through the guidance that we've been trying to be very clear about with the community that is built around public health, provider health, and critical supports in a public health emergency. We have been issuing guidance in our public-facing documents through social media, through email, that our first guidance to families in need of childcare is stay home if you can. And if not you, then do you have a partner who can stay home? Second, we're telling families, look for a trusted neighbor or friend or family member who can watch your child, stressing the importance of small group size. So that's step 2 that we're communicating. Step 3, we're saying call 211 childcare if that doesn't work and you still don't have childcare and you have to get to work. So call 211 childcare and they will direct you to community-based providers, family childcare, private programs, public programs, near where you need childcare. Call that dedicated line to get directed to programs that are open. And so those are the 3 steps that we are directing people towards. We have lists from your questions. We have built a public-facing frequently asked questions document that is posted on our website as well, and we emailed it out to providers. I wanted to go over a few of those questions with you, and you may have others. The first is, who is open and who is closed? We are working to track this, working with 211 Childcare, but who is open and who is closed is completely dependent on independent program choices. Sometimes local health weighs in. There are a couple of communities where they have closed programs, but for the most part, this is a program choice. And Governor Lamont, other governors are requiring that programs stay open. The governor has not made any such requirement. Programs that want to close can close. So I want to be really clear with that. Secondly, we do have programs that are staying open to support their families and to support essential workers. I think childcare is not used to being on the front lines in a public health emergency, but many of you are every day. Every day you're supporting hospital workers, nursing home workers, first responders, other healthcare workers, corrections workers, people working in mental health. There are some workers that have to be out there. As many of you know, the repercussions of this huge unemployment are wide ranging. And so there's a need for caretakers, and some of you are stepping up and providing that care. The governor sees childcare as a critical part of this public health emergency response, and he's been really clear with me about that. We are working and have been sending out rigorous public health guidance to programs, and effective after this evening, the governor will sign an executive order to require group sizes of 10 or fewer in childcare programs that are open, and also require screening of children and enhanced cleaning, and also space in case a child or a staff member were to get sick. So that we expect to be an executive order today. I've talked already about the small business supports. There have been a lot of questions about help. You know, my business is in trouble. We need your support. And Margaret Gustafson from our office is leading these efforts and connecting with DECD, our Economic Development Agency. I was told, thanks to the Early Childhood Alliance, there is information from the National Women's Law Center that's available online right now. That has an excellent summary of the federal supports that are now available. The other thing we announced, some of you know, we announced that our public programs will be funded through the end of June. That is state-funded centers, school readiness, Smart Start, Care for Kids at rates that will be based on March. So I know that was a relief for many of you. For others, it was not as much help who programs that are not publicly funded. So that's why we're working hard to get information out about the economic supports that are out there for small businesses. Another question, we've had a lot of questions about Project 26, which is a program that's focused on helping hospital workers who need childcare. And the calls coming into 211, there are about 5 times more calls from hospital workers than any others. Just like the rest, we're encouraging hospital workers to go through the steps. Family, friends and neighbors, 211 childcare, find existing providers. If none of that works, we work with a hospital HR department and they refer the staff who can't find care in existing spaces to a Project 26 childcare program. We set these programs up working with the hospitals. Sometimes the hospitals had a preferred provider, and other times the hospitals did not, in which case we would look to existing providers who are within 3 miles of the hospital, reach out to see if they were looking for support. If they were looking to are willing to open to take care of children of hospital workers. It's turned out that some are private, some are nonprofit, some are public. It's a total mix of programs depending on location, on their ability to take children who are infants, toddlers, preschoolers, and school agers and respond to the hospital's needs. And also, as I said, some hospitals had existing relationships with hospitals or natural partners in their neighborhood. I have to say I've been blown away that 60 programs have called in to volunteer, willing to open in the case that we need more programs to support hospital workers. This COVID-19 emergency has been difficult in so many ways, but the outreach of that many early childhood programs saying, we want to be a part of helping is amazing. The other thing I want to announce and say there'll be guidance coming out in the next 24 to 48 hours is to recognize these efforts. OEC has put aside about $4.5 million to be sent out as bonuses to family child care providers and center-based providers who are supporting essential workers, who are open to support essential workers. I know you want details, and we're working on the details, and as soon as we have those specific and we've operationalized them, we will send them out. People from the office worked on this all weekend so that we could get you guidance in the next 24 hours. But we want to recognize that childcare workers and programs that are open have extra costs due to some of the public health practices, and also that the people teaching and who are on the front lines here, that they can have some extra support. And we are writing that into the guidance that these dollars are meant for enhanced salary for the childcare workers who are out there. And some of the dollars are for some of the enhanced services, the enhanced public health guidance that we're issuing as well. So those are some of the frequently asked questions, and please do look on our website at our frequently asked questions. There were more than those, but those were the ones that I wanted to clear up. The Project 26 is not brand new programs. These are existing providers in their communities who stepped up to help, and that we're asking anyone, hospital worker, first responder, et cetera, that the call 211 childcare and find care with existing providers who can support you first before going to these sort of emergency backup programs. Starting last Friday, our licensors are now making outbound calls to reach you to get feedback and concerns. We want to hear your challenges. We are documenting them. We know, for example, one thing is supplies are a challenge for you all. It's a challenge all around the country, and OEC is working with the emergency operations centers to try to acquire hand sanitizer, soap, cleaning products that we can make available to you. We have a distribution plan when those come in. As I've said, this is an international challenge. All around the world, people need these products, but know that we are working hard to try to get some of these available, and then we'll have a regional distribution of them as they come in. The other thing that our childcare licensors are going to be checking with you about is that you are getting our memos. We're hearing that some people are not getting our memos, and we want to be sure that they can do that. So if you're not getting a call from your licensor and you're not getting the email right now, because it's going to take them a while to call everyone, please reach out to them or call the licensing helpline and have them check your email in e-license if you are not getting the memos. We want to also, you should check your junk mail. We are working to get all these memos that we have available, that they're getting translated into Spanish and then posted on the website. So please check there regularly. If you haven't gotten our memos, they're all on the website as well as our public facing documents. But we know that you have supply needs. I guess I want to spend most of the time here on your questions, and we'll do our best to answer them. And the ones we can't answer, we will send out we'll add to the frequently asked questions work that we're doing. So I'm going to ask Rachel to moderate some questions, and I'll do my best to answer them, as I said.
Okay, so one important question that's come up a few times. People are interested in knowing how can they communicate whether they have space but are not Project 26 programs right now. And also, what's the best number for them to call, because some of our OEC numbers, we'll have to check into this, are either ringing or there's no one answering them.
Okay, well, that's an issue. We are having our staff check the lines regularly. So that's a really important information for me to have. Programs can call 211 Childcare and tell them that they are open and ready to take and ready to serve children of essential workers. That's one good way. They are continually surveying, but you can call them and tell them that you're ready. I also mentioned that programs, about 60 programs, have written to the Office of Early Childhood saying they're close to a hospital and they want to be supporting the efforts in case it gets extended. And you can email me directly at beth.bye@ct.gov, beth.bye@ct.gov, if you're not one of those 60, but you want to be considered in the case that we open additional programs near hospitals. Now, we just don't know. We don't know how full they're going to be. And we are trying to first direct individuals that need childcare, first responders, healthcare workers, hospital workers, grocery store workers. We're trying to direct them to call 211 Childcare to be referred to existing programs. You are the biggest part of the capacity in this public health response. It is not those 26 special hospital programs. Those are for parents who can't find care any other way.
Okay, the next question that we have many home child care providers who are worried for their own family's health. They're also worried that if they have to close, that there might be a challenge with unemployment benefits. So if you could just speak to the needs of family child care providers. Yes,
family child care is really part of the very backbone of our child care system in Connecticut. And your relationships with families, much like child care centers, are incredibly important to you and to families. So we know that you face unique challenges because of the way that you're paid with items like unemployment. We are trying to post information for you. We know that, for example, staff of programs that voluntarily shut down are covered by Department of Labor. They just need to follow specific guidance about explaining why their closing was linked to COVID-19. But family childcare providers, much like centers, do not have to remain open. They do not have to accept new children. A lot of this is really your sort of up to you and your sense of what's right for you at this time.
Okay, I think you've spoken to we've many questions about business assistance for various reasons, because you intended to remain open, because a family member might have had COVID-19 exposure, and the direct support that programs are going to need. Are they eligible for loans? How do they contact the Small Business Assistance Program? So maybe if you could, and is there any help specifically for small non-for-profit programs as well?
Yes, I said that by the end of the week, we will have a business support link on our homepage at OEC. But right now, any of you can go to the Connecticut Department of Economic and Community Development website where they're linking this information. So you can go there, and also, as I mentioned, if you Google the National Women's Law Center, they have really good plain language explanation of the federal programs that are available. So I hope that's helpful. We believe, probably like you do, that childcare businesses are particularly fragile to start and really hurting because of this COVID-19 challenge. And as I said, we are at the table in Connecticut during these economic development decisions, and making sure that childcare businesses are represented. But we do want to keep hearing from you. What are your challenges, and how can we be helpful?
There are several questions about essential employees. First, several comments about how we deeply believe and support that our childcare workers are essential employees, and the governor does acknowledge the need for childcare, though he has not expressly named childcare providers as essential employees. But there are several questions about families and clients that are not considered essential. Are childcare providers only supposed to be accepting children of essential employees right now, and how do they communicate that to the other parents who also need care?
The governor has not issued an executive order saying that childcare providers can only provide care to essential employees. Now, we know that the order is that only essential employees should be going to work, and that anyone who can telework can telework. So there is no specific guidance on that, and so that's where we are right now. But essentially, it's only essential employees that should be going to work right now. So you're a private business. You are considered an essential employee by the governor. We are working, given that we are working with the governor. We've identified $4.5 million to bonus programs that are open to help essential employees. And that information will be out to you soon as to what that bonus is and how you receive it. So look for that soon. And that really is because the governor and OEC recognize that providing care right now is difficult and different, and that in the bonus program, it will be stated to the provider that these dollars are meant to enhance the wages of the workers.
Are we still licensing new programs like home child care programs?
Yes, we are.
And can you speak a little bit more? We've had several questions around ratios, especially given the new order that's coming around today about 10 or fewer.
We have not issued guidance about ratios. We have issued guidance about group size. And so we expect that all programs will have group sizes of 10 or less. And certainly we anticipate that there will be some extra staffing to meet the requirements, such as screening children before they come in for fever, et cetera.
Can you also speak to the next round of payments for Care for Kids and school readiness? Will they be based, can you clarify if the payments will be based on what providers received in March?
I'm really going to direct people here to memo, I think it's memo 13. I think it was lucky number 13 on our website. Are any of the staff on the phone able to read that very specifically for people that might not be able to access it via cell phone or via the internet right now? Because I know the language is very particular and I don't want to misspeak. Or I can just pull up the memo.
Yeah, I can pull it up. Beth, which number was it?
OEC number 13.
Okay.
And I urge you with a lot of these questions to go right to the memo. I've got the memo here. It says OEC commits to paying the following publicly funded providers at the same level of funding as received in March of 2020 through the end of the current fiscal year. So that is the guidance that we're giving. I hope that's helpful. And that's actually just a good example of how we are trying to keep all of our communication readily available on our website. And we're encouraging our licensors when they call out to you and our staff to refer to those memos and refer to our frequently asked questions so that we can be very consistent in our communication with you.
We've had several questions about caregiver age and whether caregivers over a certain age, whether it's 65 or 70, should continue to go to work, or if there's any responsibility they have because of their age and perhaps receptivity to COVID-19, should they close?
My guidance would be to contact your physician, your own personal physician, and if you'd like, your local Department of Public Health. So that, I'm not fit to give medical advice, but your primary care physician should be. And you can also go to the Center for Disease Control. It's a website. I know I have a brother with certain health conditions, and I was able to take him through the guidance on the CDC website as well. But I would encourage you to look at that.
Okay. We have, okay. There have been multiple questions about business assistance, so we'll make sure that we put that in our follow-up communication exactly where you should.
Well, Rachel, I'm really glad you're mentioning that, and it's part of why I really stress this. I think, that is the great unknown, that people want all the information they possibly can. Again, we were a fragile industry before, and we all need to work together to look for solutions to make sure that our industry survives this and that our programs survive it. Our families and children depend on it. And so I just want to be really clear with the listeners that this is on our mind. I've spoken to at least 6 or 7 private childcare providers personally, and I know the challenges you are under. I don't have any easy answers right now, but I promise you we are looking for answers. We are open to your guidance and input, we can't, I know I personally, listening to the stories, I can't even imagine the heartache and the difficult choices that you have right now, because you take your role as an employer so seriously, and you care so much about your staff, and you care so much about your families. You know what you mean to them, and yet your whole business model is threatened because of this long stoppage of work for so many parents. So we are digging. We're looking at what other states are doing. We've been researching this morning other states. We're working with the National Association for the Education of Young Children for guidance about best, state approaches for this challenge. So we're looking, we're open to input for you. And the reason that keeps coming up is because this is really a huge challenge for you and for OEC, and really for the children and families in Connecticut, ultimately in the long run.
We have several questions about both applying for Care for Kids funding, but also for programs receiving Care for Kids funding. So I just know from earlier conversations with the Commissioner that many essential workers very likely qualify for Care for Kids. and perhaps have been relying on family, friend, or neighbor care, but aren't able to do so at this time. So because of either exposure to COVID-19 or other reasons. So I'm answering for you, Commissioner, to say that people can still apply for Care for Kids, and there is not a processing backlog. However, if you want to speak a little bit more to receipt of Care for Kids from the provider side.
Well, yeah, and I would just reemphasize that. I've been hearing in my own community from a lot of grocery store workers who were not on Care for Kids. Most of them will likely qualify, and I'm encouraging them to apply. On the provider side, Memo 13 says that levels of funding for Care for Kids received in March 2020 will be received through June 30th of 2020. So you will continue to receive your Care for Kids payments.
And for those certificates for families that are coming to open sites from a closed site, will the open sites also receive payment?
We are working through this question with our federal agencies. This is a very rare, I think this is a rare occurrence, but we are working through that question and identifying ways that we can support both the provider the family was with, but also support the family that's in need of childcare now. So that is in process. I appreciate that question, and we will send out an answer as we resolve that with how we're managing that.
We have a question about the school readiness RFP process continuing on schedule or not.
We will have information to you very shortly. I would encourage the, folks working on school readiness RFPs right now to hold until you get guidance from the Office of Early Childhood, which should be coming within the next 2 days. So we are working through that in our office. We're addressing your concerns and also making sure that next fall we have the best possible lineup of early childhood programs in our school readiness district. So we will answer that in the next couple days. Thank you for that question.
I have to re-ask another question. There was a question about clarification on whether family providers can collect unemployment. And I believe you offered an answer, but just to reiterate it.
Well, I don't think I offered a clear answer besides consult with the Department of Labor. I believe that most family child care providers operate in some ways as contractors, but I don't want to speak for every single family child care provider, and we will work to get out clear guidance about that, about unemployment for family child care providers. We were certainly hoping that extending the Care for Kids through June 30th would help Care for Kids providers to remain on the payroll, but there are a lot of family child care providers who don't get Care for Kids. So we will work to get you clear guidance about unemployment.
Okay. I'm just reviewing a few more of the questions to make sure that we've covered. We haven't asked your question in the exact form that you posed it. Please know that we're also going back through these questions. There's some that we just aren't prepared to answer yet, but we will be going back through them to make sure that they're reflected in our frequently asked questions document that we'll be posting to our website.
I do see, Rachel, there's a question about summer camps.
There's several, yeah.
Yeah, so we issued guidance at the beginning of this COVID-19 emergency. We issued guidance that summer camps could open under their summer camp license now and operate as childcare. They'll have to follow the group size of 10 or less, but we recognize that they are in a position to serve children and families at this time. And other than that, for right now, summer camps are still going forward. Again, much like the private childcare programs, I'm sure that summer camps are feeling a lot of anxiety. These are often small nonprofits. They provide an incredibly important service to children and families. They can be life-changing. And yet they operate on a very small margin, much like child care centers. So they too face challenges, and I'm sure their whole enrollment process is disrupted, et cetera. So we want to hear from you as well, Camps, about ways that OEC can support you. I'm sure the parents are concerned about putting down deposits with all the uncertainty. So I think you're a very important part of the business response as well, and how the federal dollars can be used to make sure that you can continue to operate after the COVID-19 emergency.
Thanks, Commissioner. That answers the questions that we did have from licensed camps who want to provide childcare now. But for listeners, you heard that we don't yet have guidance, but we'll be coming to you soon with that guidance as the information we get changes all the time. So we have a question from agencies that have home visiting services, how they should be changing the way that they operate during this emergency time. We did have a special teletown hall just for home visitors, but I don't know, Commissioner, if you want to speak a little bit to that question.
Sure, yes, and birth to 3 and home visiting are not at all forgotten. We have done specific town halls for them, but we know also many of you interface with them as well. They're providing critical services. They're needing to do it now through teletown hall, which is a big change, not teletown hall, through telemedicine, excuse me. So they're practicing that with telemedicine and figuring out how to support families, as many of you I know are. I know many a parent who has been sitting at Circle with one of your teachers from one of your programs who are working to make sure they stay in touch with children and families. And I know, there are a lot of teachers very sad. They have such close relationships with the children, but I know even many who are unemployed are reaching out, and they're on unemployment and they're reaching out and still supporting children and families. But birth to 3 and home visiting continue, but like childcare, their small nonprofits are also really challenged. They are able to deliver the service remotely with some new rules. But like I've been saying with childcare, if you're a birth to 3 or home visiting provider, please send us your questions and your feedback.
I just want to reiterate that we did talk about the fact that health and safety inspections are still happening. We received a late in the game question about that. And I'm just looking to see. There's a number of questions about our joint work with the Department of Children and Families. And suggestions for us to actually field some calls together. It's sort of a comment and a question, but also for support for children who are engaged with DCF and how that will work.
Yes, that work goes on. When we're engaging with DCF, it is often around concerns around abuse and neglect of children. So those visits are still happening. We are still following up on concerns and complaints. And this is a chance for me to give a shout out to OEC staff, many of whom are, out there in the field, making sure children and families are safe. They've been working many hours over the usual hours and responding as best they can to your questions and concerns. It's been a challenge, but I'm really grateful for their work and their willingness to continue with issues like DCF concerns around child safety and supporting the work of DCF and DCF supporting our work. So we continue to work together.
We have had several questions around how to use current slots potentially for essential workers, but also how to advise parents who are uncomfortable with sending their children and holding their spaces. I don't know if this is something, your answer might say something like, what are your handbook policies? But then we also have some questions about if I'm a small provider or a home provider and I don't have a handbook. If you could offer a little bit of guidance or ideas on those topics. Yes,
well, licensed programs are required to have a payment policy with their parents. So we know all of you who are licensed have that. And we do encourage you to look at your program policies. I wish I had an easy answer to this one. We're getting calls, a lot of calls from parents, a lot of calls from providers who are open, but parents are not bringing their children and who are dropping, et cetera. This is what we're talking about in terms of concerns for the long-term viability of the field. So this question and concern is going on all over the country. It's being guided by individual program policies, and also and by parents' decisions to say, fine, then I'll pull my kid because I'm not going to keep paying if this is 3 months. And parents who are faced with job loss who don't have the money to pay. So there's empathy on all sides on this one. And I think my guidance has to be, look to your handbook.
There are a couple what if questions that you may not be able to answer, but I think it's important to raise. Will there be extensions for fingerprints physicals for individuals that may have expired during this time? And,
yes, all of those are, if you look to our memo, bring you back to our memo, we have a memo about waivers. I believe that one is number 7, but I will confirm it while I'm on this call. So we have a memo, I'm looking right now, waivers, COVID-19 waivers. So that was issued on March 16th. And we are getting these memos translated as well. So health and immunization records on file prior to the declared state of emergency, which expired during the state of emergency, are acceptable. Same with CPR and med admin that expire. The requirement that the acting director have to complete 3 credits. So I'm not going to walk you through all of these, but there are more than 20 waivers to our current statutes to help you operate in what we know is a really unusual time. So you can go to our website under, it's called COVID-19 waivers.
Okay, we had a question about, and again, this is relating to summer, but it's kind of relating to current time. So for programs that operate in school buildings in the summer, do we have any sense yet if schools continue with closures, if those programs will remain open? I think I'm raising this just so we connect with Commissioner Cardona about it.
Well, I'm glad you asked this question because can you hear me? I know, Rachel, you're breaking up a little bit. Can folks hear me?
I can hear you.
Okay. What's important to know is the governor's executive order canceled classes at all schools. That's different than closing all school buildings. So a lot of those questions can be answered at the local level if the localities are going to allow their schools to be used for those purposes.
Okay. We have several more questions about unemployment, which I think some are specific and some are offering up information to the group, which we will
send that out. Yeah.
After.
Yeah.
Oh,
thank you for helping each other.
Do we have any knowledge of whether the Department of Children and Families is also extending payments to providers through June?
Oh, that I do not know, but I am happy to reach out to them and ask that question because many of you are impacted by that that decision. So we will reach out and ask that of DCF.
And I'm just checking through to make sure we've covered the sort of the gist of the rest of the questions. If there are other questions that attendees have that they want to share in the questions pane, this is the right time.
Well, if we've covered most of them, Rachel, I think people are obviously under stress and busy, and we can end a few minutes early. But I just want to close by saying thank you for what you've done and what you're doing. Just on this call, I've gotten about 30 more emails with questions and input and feedback. We are better together if we go through this together. And I know my team is working hard to address your questions and concerns. You're helping to inform our next frequently asked question document. So I just want to close by saying thank you, and we're in this together. And this is a difficult time for all of us, for our families, for our communities, for our friends. And I think Connecticut is counting on early childhood as part of this. It's essential for those workers who are taking care of our family and friends who get sick to be able to get to work. And they are anxious and stressed as it is. We need to be sure that they're comfortable, that their children are in a safe place and cared for. So I can't thank you enough for being on the call. I just said it the 4th time. Every day I am amazed by the work of you all and by the staff at the Office of Early Childhood. People are working extra hard, understanding the gravity of this moment for our field, and at a time when the whole country is recognizing the value of our field in ways that they haven't before. But we've got to make sure that that value turns into support for us as we step up during this public health crisis. So have a good afternoon.